Okay, so through this training, I am going to, I kind of gave a little introduction. I'm going to share a definition of some terms that might come up. I'm going to share some statistics from a variety of sources. I'm going to share about the common mental health disorders that we see in perinatal mental health and discuss risk factors, touch on some cultural considerations, go over a few interventions, and then share some resources as well at the end. And here is my name and here's my email address. So you can feel free to email me. And especially if you also work in this area, I would love to get connected with you. So you can feel free to just chat me and say hi. Thanks. So just sharing a little definition. So the term perinatal often refers to the time before, during pregnancy, and right after the birth. So it is different than prenatal in that it encompasses the time right after the birth as well. You may have heard of the term the fourth trimester, which is the months that are following the birth of the baby. And that's a really important time of adjustment, an important time to screen for mental health disorders, as well as holding space for the new parent and the baby. So often perinatal in this field, perinatal and maternal mental health are often used interchangeably. I did read a few different sources use their terms in a different way. The World Health Organization actually defines maternal mental health as the health of women during pregnancy, childbirth, and the postpartum period. And they refer to perinatal mental health as health from 22 completed weeks of gestation until 7 completed days after birth. And to be honest, I'm not quite sure exactly why they pick those dates, but a lot of different resources and places that you'll read will use both terms, but we're seeing perinatal health more and more. And it may not technically fall under this description, but in the focus of my work, I really like to take into account all other aspects of reproductive health and family planning. So that includes those who are seeking an abortion, those who are experiencing infertility, those who are considering fertility treatment, surrogates, adopting. There may be different issues that come up, especially regarding your physical health and hormonal changes, but it's still an important period of adjustment and potential loss and trauma. And so this also includes fathers or the other birthing parent or partner, and things like infertility, pregnancy, and a new child. Those can bring mood changes to anybody in the family and the household. So a word that you will hear sometimes in this field is, or an acronym, PMADS, and that stands for perinatal mood and anxiety disorders. So for us in the mental health field, diagnoses that are often seen in this population to be aware of are depression, anxiety, and rarely, but still important, is postpartum psychosis, bipolar disorder, or postpartum post-traumatic stress. And a disorder occurs when the symptoms are greater than the expected new stress of new parents and impair the pregnant person's ability to function. So I'm also going to share just a quick note on language. So often the world of perinatal mental health and maternal mental health uses very gendered language, although this is changing a lot. And so I understand that not all people who are pregnant are women or identify as women. And of course, not all women are mothers or will become pregnant. So I try as often as partner as possible to use the words pregnant person, birthing person, or parent to describe what I'm trying to mean. However, often in these slides, we'll see the word women. And that is usually when it comes to a statistic or quote from a study or article. And since those are statistics used from a study, I try to just use the same language. But I really do like just the term perinatal health because of that as well. Although we will often see maternal mental health used in the field. And I also just want to add that while We will see that many pregnant people are not screened for potential mood and anxiety disorders. The numbers are even lower for marginalized communities, including parents who are transgender or non-binary. And there's often a huge lack of resources and support for this community. And so that's an important thing for us as clinicians to be aware of as well. And this is a quote that I really like from a study on the lifelong effects of early childhood adversity and toxic stress, which is psychosocial care in the perinatal period is the next frontier in advancing maternal and infant outcomes, and indeed the well-being of society at large. So that really says well to me why this field is so important. And it's important to add also that the World Health Organization considers improving maternal mental health outcomes an important area to focus on globally.